Our speaker today is Dr. Colin Robinson. Dr. Robinson is the medical director of WelbeHealth's program of all-inclusive care for the elderly, or PACE, P-A-C-E, a program enabling frail seniors to continue living in their homes. Dr. Robinson was previously Chief Resident and Assistant Program Director at UCLA Health, where he oversaw training in clinical medicine, patient advocacy, and healthcare quality. Dr. Robinson earned his BA with honors from Washington University in St. Louis, his MD and MPH from Tufts University School of Medicine. Dr. Robinson, good afternoon and welcome.
Good afternoon, Yvonne, and thank you for having me, and thank you to all of our attendees for joining us today. I'm really excited to talk about this. This is the beginning of the flu season, so I want to make sure that we start off the season right with the right information, especially because this is coming right on top of our unfortunate COVID pandemic that we're experiencing and have been for the past 6 or 7 months. So I'm going to pull up my screen. Are you able to see my screen yet?
Yes.
Excellent.
Yes.
All right. So I'm going to, as I was saying, I'm going to talk about flu, and I'm going to talk about it specifically in those who are seniors, so 66 or 65 and up. Although in the PACE world, we actually take care of people as young as 55. But we take care of the medically vulnerable and frail, so that's includes those who are 55 with medical illnesses all the way up to we have seniors who are 99, 100 years old in our care as well. So I'll skip this because Yvonne already gave me a really fantastic introduction, so thank you for that, Yvonne. So next is the kind of discussion of flu in our frailest seniors. So like I was mentioning before, we do take care in PACE of the most vulnerable residents in our society, citizens in our society. Our average age is in the 70s. So we're really concerned about our seniors potentially getting influenza. As many people have probably heard already, seniors are at highest risk from having bad complications of the flu, just like they are for coronavirus. So if you look here at this, these two pie charts, you see on the left, in purple are those who are 65 and older, and in gray are those who are under 65. So amongst those who are actually hospitalized for influenza virus, the vast majority are those who are 65 and up. So even though the majority of the population is under 65, those who are in the hospital for flu are by and large 65 and up. And this is even more, I think it should also be said that most flu infections, again, because so much of the population is under 65, actually happen in those who are under 65. But that means that if you are over 65, the likelihood that you need a hospitalization goes up dramatically. So that's on the left, and on the right we see the number of deaths, or the percentage of deaths from influenza, which again in the older adult population is just way disproportionate to the younger adult population. So 65 and up represents 90% of all deaths from influenza, and so that's why we care so much about this virus and preventing this virus, because our participants, our patients, are those who are at highest risk for having a bad outcome from influenza. So this year, there's been a lot of discussion about whether it'll be a better year or a worse year for influenza. So it's worth talking about what are the factors here that play a role. So one is, to start with, I'll talk about the negative factors. So one is the possible escalation of COVID-19 with more time indoors during the colder months. So we know the viruses tend to be a little bit more transmitted a lot of the times during the winter. So that is a very big reason that the coronavirus influenza virus is more likely to happen over the winter. That's why our season for flu is the winter. So we expect that there might be more transmission that way in any given winter season. And at the same time, because we're seeing the coronavirus still out there in society, out there causing infections, there's still going to be a higher demand for hospital and lab services. So there's a good chance that our patients 65 and up are going to have more of a delay or not get quite the same medical services that they normally would, where they're not also a major pandemic going on. On the plus side, we are seeing that the preventive measures that work for COVID-19 will also help for flu. So wearing masks, creating distance between ourselves and others, washing hands frequently, and avoiding highly crowded public spaces. Those are all things that will not only prevent coronavirus 19, but also influenza. So that's a good thing. Unfortunately, we have to go through all of these measures, but at least it'll help us to prevent the flu. We also know that people are a bit more attuned to the prevention of viral infections this winter, because coronavirus has brought up so much stuff in society. Awareness in society is so much higher, so that people are more likely to look for vaccines. They're more wary of the flu virus, and so they are more likely to get vaccinated. And then the other good thing that we're seeing is that in the Southern Hemisphere, which is the opposite season to us, they're having a milder flu season, or they're just exiting a milder flu season than they have in normal years. And that's, again, likely because they have had the same measures in place that we have had to prevent coronavirus transmission. So it also may be a factor of the flu virus is a little bit less strong, or a little bit weaker this year, but it's probably more likely that it's because of the measures that people have taken in order to prevent coronavirus, and that prevents the flu virus from being transmitted as well. So just to make sure we distinguish between flu and coronavirus 19, they are two very different viruses, two different families of viruses. So that's important to know. For one, that means that immunity to one doesn't necessarily mean immunity to the other. In fact, there's no way that immunity to one would represent immunity to the other. They're different in that way. It's possible to be infected with both at the same time. Because they're different viruses, you don't have immunity from one transferring to the other. So that's really important to bear in mind. Is the worst thing that could happen is to actually get both viruses at the same time, especially if you're 65 and up. So we really need to be careful in that way. Another important kind of difference between the two is that bacterial infections commonly follow influenza infection. So we saw 100 years ago during the pandemic, 100 years ago of 1918, 1919, we saw a lot of the deaths, unfortunately, were because of bacterial infections, meaning it wasn't just the virus that caused the illness, it was a bacterium that set up an infection in the lungs, such that a lot of the people who died in the flu pandemic actually died because of bacterial infections, and that's not seen as often in COVID-19. So that's an important distinction between the two, because sometimes people will get a bacterial infection after they get the influenza, or while they're still fighting through an influenza infection. So that's really important to bear in mind. And people who are significantly at higher risk of deaths from COVID-19, are those with underlying conditions, and we want to prevent the flu virus doing the same thing to those who have underlying conditions like diabetes or heart disease or high blood pressure, and the common things that we see in those who are 65 and up. One of the important differences between the two viruses is that there are some additional treatment options for the flu that we don't see for coronavirus. In coronavirus, just like in the flu, we of course offer supportive care, IV hydration or hydration in the veins, oxygen as needed. A lot of the evaluations will be the same. But one of the things about influenza is that we do see a number of antiviral medications that have been approved. So they're available by prescription. They can lessen the amount of fever and flu symptoms that an individual has. They can shorten the time that someone is sick from the flu. But it is important to know that it's not the same as taking an antibiotic for a bacterial infection. It doesn't necessarily prevent the deaths in the same way that an antibiotic does. So it'll help with symptoms, but it doesn't necessarily just cure the virus altogether. So that's really important to bear in mind. If you are going to be getting one of these antiviral medications for the flu, you're going to need to get it right away, meaning that it's only really effective if it's given within the first couple days of infection. So if you're worried about having gotten the flu, then immediately seek out care so that you could get that, that antiviral medication, which will hopefully then worsen or improve the course of the illness, so you don't have the worst outcomes of it, of fever and symptoms. So again, just be on the lookout if you do have flu symptoms to get seen right away, just like we would recommend for coronavirus, because at least we can try some outpatient therapies, which are just medications by mouth. A very, very important point about influenza is that we currently do have a flu shot, and you're probably familiar with this. Every single year there's a new flu shot that comes out, and the flu season is currently upon us. So it starts around September or October and runs for approximately 6 months. So we'll see up until March or the very beginning of April. And that's a new virus compared to the one that was around last year. So last year we saw one type of flu virus. This year we're going to be seeing a different one, which is why there's a new vaccine. So a common question is, if I got a vaccine in March of 2020 and it's now October of 2020, does my previous flu vaccine actually count? And the answer is unfortunately no, because it's a new strain that we're seeing circulating at this point. So if you had one at the end of last year's flu season, definitely get one at the very beginning of this year's flu season, because they are going to be different. One of the really nice things about the flu shot is that it's covered 100% by Medicare, Medicaid, and private insurance. So that's a really great feature that we're able to get vaccinated without without issues with coverage. So as long as you have insurance in one of these realms, then you should be able to get the flu shot. The other thing that's nice about the flu shot is it's everywhere. So you can get it at your PCP, your primary care physician. You can get it at an urgent care clinic, pharmacies. One of my colleagues went to an urgent care last night, and another one went to a pharmacy just to get the vaccine. No problems, they received it without an issue. But it's also interestingly available at grocery stores. I know at certain Ralph's or Costco or other California stores, they do have the flu vaccine available. I would recommend to maintain distancing like we want with coronavirus 19. If there is an option for outdoor or drive-through vaccines, try to take advantage of that, because we of course want to minimize how much people cluster and get together in healthcare facilities, because that can again lead to people thinking they might have the flu or might have coronavirus, being in contact with people who don't, and we want to be avoiding those situations. And then the final point about the flu shot here on this slide is that for older adults, 65 and up, you actually need a higher dose than someone who's under 65. So you need to get the high dose flu shot if you're 65 and up. And there are several different brands, but you need to ensure that because the immune system is not as strong in people who are 65 and older, that we need a higher dose, stronger vaccine in order to protect from the flu virus as well as possible. So just remember that if you're 65 and older. Okay, and I believe we have a poll Roy, can you take us through the poll?
Sure. So the question is, which of the following are true, and check all that apply. You can get the flu from the flu shot. You should get the flu shot every year. Serious side effects are common from the vaccine, and the vaccine doesn't increase your chance of catching COVID. So please go ahead and vote. And Oh. Okay, just a couple more seconds for those of you who haven't voted yet. Okay. Okay, closing the polls, and so this is what the results were from you guys. So 13% of you said you can get the flu from the flu shot. 93% said you should get the flu shot every year. None of you said that serious side effects are common from the vaccine, and about half of you, 47%, says the vaccine does not increase your chance of catching COVID. So I will let Dr. Robinson address those.
Yeah. I was unfortunately unable to see the poll, so I jotted down a couple of the responses. So yes, you should definitely get the flu shot annually. That is without a doubt the recommendation of every medical society that's out there at this point, especially for those who are 65 and older. But you know, those of us who are under 65, one, it protects ourselves, and two, it protects our loved ones. So just remember that the more people get vaccinated, the fewer people are going to get flu, not just because they are protected, but because they're not going to get it and then pass it to somebody else. So that's really, really important to bear in mind. The next one is that comes to mind here is getting flu from the flu shot. So that's a really common concern about the flu shot, in that people worry that they're going to actually get the flu itself. And so an analogy that I'll often make about this is that we only give a part of the flu vaccine or flu virus in the vaccine. It's only a little piece of it. So it's almost like saying you have a door versus an entire car, right? So if you only have a portion of the virus, you actually can't cause the real infection called influenza. You can only cause a little bit of the immune response to that piece of the virus. So people do sometimes get low-grade fevers, or they might get sore or a little bit of achiness, but they don't get the flu itself. They don't have the breathing symptoms, the other symptoms throughout the body that you might see from flu. I'm glad to see that no one thinks that there are serious side effects from the flu shot. That's a common misconception as well. And then so about 47% said it does not increase your chances of getting COVID. So that's exactly right. So the flu shot definitely will not increase your chances of getting COVID. And hopefully it would decrease the chances of having a bad COVID outcome were someone to unfortunately get it, because you're less likely to get influenza at the same time. So again, you can't get flu from the flu shot. You can't get flu from the flu shot. I can't impress that enough on you all, because it really is only a portion of the virus itself. You can feel a little achy or sore afterwards, but beyond that, it's really not the flu shot if you're feeling truly ill. Definitely should get the vaccine every year. The side effects are super, super rare, and it doesn't increase your chance of getting COVID-19. So common symptoms between the two, so they can look very similar, and that's one of the reasons why if someone suspects that they might have either of these, they should get seen right away and get tested for either or both, depending on the situation. So fever is really, really common in both of these. So feeling feverish, feeling chills, shaking, being cold when you wouldn't normally be cold, those are all reasons to suspect either of these. Cough, both of them are viruses that affect the lungs, and as such, they can cause shortness of breath, they can cause difficulty with breathing, they can cause fatigue. It's really common, and especially in our older adults, sometimes people don't mount fevers quite as much, or they don't have quite the similar symptoms, or the classic symptoms, and it might just start with being a little bit tired. And so we're always on the lookout for someone feeling tired. We also see sore throat, nasal or nose symptoms, so runny nose, stuffy nose, muscle pain or body aches, common with both of these, headaches, and vomiting with diarrhea. That can happen in both coronavirus or influenza. So we want to be on the lookout for any of these. So vomiting and diarrhea, while we think about it as food poisoning or other sorts of infections, can definitely be either of these. And if the timing is right, the season's right, if you've been exposed to somebody, these are all reasons to think that it could be flu or coronavirus. So if someone does have symptoms, it's crucial to get in contact with your healthcare provider right away. So don't wait it out this year, get seen right away. If you end up having influenza, then hopefully you can get one of those antiviral medications that you can take at the very beginning of the infection to decrease the amount of the symptoms. That would be a great way to deal with it. And then, of course, if it ends up being coronavirus or flu, it's really important to be watched closely. So you want to be diagnosed with one of these as soon as possible, rather than waiting it out for 3, 4, 5, 6 days. At the very beginning of symptoms, it's really good to get seen. Stay home and monitor your symptoms. So please be very aware of the symptoms that we talked about before, and if they're getting worse, especially the symptoms of shortness of breath or difficulty breathing, because that's where we see the most bad outcomes from either of these viruses, is because people are short of breath, they're not getting the oxygen they need, and so they're, they can succumb to the viruses because of that. So that would have to be monitored very, very closely. We, of course, would have to monitor for dehydration, so people becoming dehydrated, not drinking water very well, or not keeping liquids down very well. We have to monitor that very closely too. And it's not necessarily a bad idea, if you see your provider once and you're diagnosed with either of these, get a follow-up within a few days just to make sure that things are going in the right direction. We also know with either of these, they can get really severe or very significant very quickly. So we don't want someone to be at home without being watched, and then all of a sudden the virus gets much worse. If you do have any warning signs like trouble breathing, chest pain, confusion, a lot of sleepiness or really significant fatigue, or any signs that oxygen isn't getting into the lungs very well, so blue lips or blue face, immediately call 911. You will need to get seen right away and get all the workup and possible treatment as soon as possible, so that, again, as these viruses can move quickly, that there's care there to prevent the bad outcomes from these viruses. So I'll pause for another poll with Roy.
Okay, so the question is, which of the following preventative steps are true? And please check all that apply. 1 is I should limit my exposure to others. 2, I should take preventative steps when I go out in public. 3 is I should maintain good, healthy habits. And 4, the flu vaccine is the only one that I need this year. So please check all the ones that you believe are true. Okay, just waiting for a few more stragglers to vote. Okay. Okay, so I will share this. So question number 1, I should limit my exposure to others. All of you said that was true, which I believe is true. The second one, I should take preventative steps when I go out in public. Again, 100% of you noted that was true, and that is also true. I should maintain good, healthy habits. And again, 100% of you got that right as being true. And then the last one, the flu vaccine is the only one I need this year. 43% of you thought that was true, and the rest of you feel that there's another vaccine you need to be taking.
Okay, great. So yeah, it sounds like the first 3 points were all correct. So we want to limit our exposure to others. We want to take preventive steps when we go out in public, just like we've been doing. A lot of the same things that we would do for coronavirus, we're going to be doing for the flu. And then maintain good health habits. The other point about flu being the only vaccine that I need. So it's really important to remember that there are other vaccines that people get, especially once they turn 65 and up. But also if someone's younger than 65 and they have, say, diabetes or emphysema or heart disease of some sort, we would also recommend that someone get the pneumonia vaccine or pneumococcal vaccine, because this we know can really prevent the bacteria infections that can happen on top of an influenza infection. So we really do strongly recommend that everyone gets that vaccine at least once. And depending on your health conditions, you may need it more than once, or 2 different types of that vaccine, which have slightly different activities, but can add up together to a really good protective response. So if you haven't had the pneumonia shot, in addition to the flu shot, definitely ask your provider about that, okay? So in terms of staying active and engaged and healthy this winter, we want to encourage everybody to stay physically active, practice healthy habits to help cope with stress. So, it's going to be darker out, the days are going to be shorter, and we've already been seeing more and more people staying inside and becoming less physically fit because they've been trying to protect themselves from coronavirus, and that's absolutely the correct thing to do. But if it's possible, right, and safe to do so, we really encourage people to be physically active in what ways they can, whether it's taking walks around their neighborhood if they are able to keep the right distance from other people, or doing even simple chair-based exercises at home to help stay isolated, but also get some exercise in. So this will be really helpful, because the stronger the body is going into the winter, going into an infection, the better the body would be able to fight it off as well. And of course, staying physically active is good for mental health. We know that the endorphins and chemicals that our body releases when we're physically active also help our mental health, our brain. They help us feel better, more awake, and then sleep better at night. And so that's all really important. Another really important point is to stay socially engaged with others the ways that you can. So via phone or via video chat. So that's really important to do. If you have loved ones in your life, it's sometimes good to just schedule times so you have a reminder to meet with them every Sunday or every Wednesday. I'll be talking with my son or my daughter or my father or mother. Video chat can be great because it's really nice just to see someone smile and just know that they're there. They can show you what's going on in their environment, in their world. We actually at WelbeHealth were able to give all of our participants these tablets that you see in the photo here, which are called the Welbe links. So we use those to be in touch with our participants ourselves, and they're able to sometimes call one another if they link up with somebody. So again, like we mentioned in our last webinar, please don't put off preventive health care or emergency care. We do worry that people are not going to get the preventive care that they need because they're so nervous about flu or coronavirus. So if you need a preventive service, or if you need to follow up on your diabetes or blood pressure, please make sure to get that done. You may be able to get those things done remotely if you have that, if you have that capacity or that ability, or your provider does as well. I definitely recommend getting or staying on top of that, and don't allow that to fall behind, because now we're about 7 months into the pandemic. And for certain, we don't want to put off emergency care. We've seen a lot of people nationwide not go to the hospital when they really needed to go because they were so afraid of coronavirus. So we know that with proper PPE, proper distancing, the chance of getting coronavirus is low. And if someone absolutely needs care, then we should definitely provide that care. We wouldn't avoid emergency care. And then continue your medicines. Don't change treatments without talking to your provider. It's going to be really important to be in touch with your provider throughout. Again, we don't want our seniors to go 12 months without talking to their providers. That's just not good for them, because we worry about things getting lost, illnesses going untreated. So we really need people to stay in touch with their providers so that they don't lose track of their conditions. And so with that, I thank everyone for your time and attention and participation in our polls, and I'll open it up to the audience for questions that we can answer.
Okay, Colin, here I got the first one here, and you have to forgive me for mispronouncing some of these. But I was wondering if you could talk about seroconversion and waning effects of the flu shot. Are the vaccines similar in seroconversion in the elderly that were previously vaccinated in the previous year?
That's a great question. So I do have to admit I haven't seen the seroconversion rates for this year. I know that in previous years it hasn't been 99% like some of the other vaccines that we use. Oftentimes in flu season, the vaccines that we use is they're in the 60 plus or minus 70% range, which I know doesn't sound quite as good as 95 or 100%, but that actually means you're significantly less likely, right? More than half less likely to get the virus just by simply having had the vaccine. And then that's not even taking into account the herd immunity effects or the immunity that other people get as well, and therefore would not be able to transmit the virus. So typically, it's a little bit different from year to year. So converting from a prior year may or may not say predict converting in this current year, but we also don't know who's going to convert and have great immune responses. So the mission is to have everybody vaccinated so that everyone's got the chance to create that immune response, so that the minority of people who don't get the same immune response are still able to be protected or feel that protection from our communities as a whole being as protected as possible.
Okay, next question. Does the vaccine contain a live virus of the flu?
So the vaccine for the flu virus that we give does not contain a live virus. So that's a really good question. So there are some vaccines out there for different infections that do use live virus, but that's not the case for this one. And actually, there are some versions of the flu vaccine, again, that did use in the past the live virus. But the ones that we give, especially the high dose one for our seniors, but also our lower dose one for our non-senior participants in the PACE world, those are all not live viruses. So I want to make sure that's really, really clear. So there's always that worry that, like I said before, if I get the vaccine or I get this, the inhaled flu vaccination, then that can cause the infection. So when we give the high dose flu shot, that is not a live virus at all.
Okay. Are there differences in the strains of flu that cause more death in people that get COVID?
So are there differences between the strains of flu that cause more
deaths from COVID?
That's a really good question. I have to say I don't know the answer to that one. I think we're also pretty early in the season of influenza to know that answer here in the United States, because we are still very early. Fortunately, we haven't seen the curve go up in terms of influenza. So off the top of my head, I don't know if there are particular strains that are worse than others. I would imagine that whatever strains are going to be worse anyway are going to be worse in the setting of coronavirus.
What is the difference between flu vaccine for people over 65?
What's the difference? Yeah, so it's a higher dose vaccine. So it'll end up having just more of the flu particles, again, not the flu virus, but the pieces that our immune system forms a response to. So that way, with more of it in the body or more of it at the site of the injection, the immune system is more likely to recognize those little pieces of the virus and form a really good response that would protect somebody from flu.
Okay. Terry wants to know, can we get a copy of the slides for our senior residents?
I think that's, that's a great question. I do believe whether we can
absolutely
disseminate the slides, correct?
Terry, I have your email, so I can send those slides over to you.
Yeah, that would be great.
Okay, here's a question. How often is it necessary to get the pneumonia shot?
The pneumonia shot, great question. So it's a little bit tricky with the pneumonia shot. So starting with people who are under 65, because I do take care of folks who are under 65 as well. Our participants start at age 55. So for those individuals, those participants, if they have, say, diabetes, they would need just one. If they have a really, really significant immune problem for whatever reason, a cancer or very bad problems with their kidneys, they might need more. And then once someone turns 65, if they have no major medical conditions or no major immune conditions, I should say, they can get either one or two, and that kind of depends on the provider and the patient's preference. So we used to say always 2 pneumonia shots once you're 65, and now it might just be 1 is sufficient. So that's actually good news, so that it takes less time to feel fully protected. Again, if someone has a really major immune system issue, we do require more, the body requires more, I should say, to get that immune protection. But say your average person who turns 65 may only need 1 pneumonia shot to be fully protected, at least based on what we know now, for the rest of their lives.
Okay. The differences between the flu vaccine and the flu block vaccine.
So flu block is just one of the trade names. So there are several different trade names that are out there. I'd have to look up specifically what flu block is, if it's for high dose for seniors or for a regular dose for younger individuals. But suffice to say, the flu vaccine comes in a bunch of different brands, and flu block is one of them, but there are a number of others as well.
In what months should seniors get the flu vaccine?
Good question. So we started back in September, actually, as soon as it was available, giving the flu vaccine. So, there's never too early in the season. So we've had people getting it in September, October as well. Is a time a lot of people start getting the vaccines. So this is about the right time because you want to be, especially if you're a senior and you're vulnerable, you want to be at the beginning of the season getting the vaccine so that the rest of society, if they do start to get more flu diagnoses out there, you're already protected as a senior. And that way, you have that coverage starting in, say, October, November, December, January, February, and you're going to be covered throughout that time much better than if you get it at like middle November when there's already more flu cases happening out there.
Okay. Those are all the questions that we have. We did get a couple of reminders in chat from Yvonne that the flu vaccine is available now, and to ask your healthcare provider for more information. And also, as a tip, wash your hands for 20 seconds and avoid touching your nose, mouth, and disinfect areas commonly used by others. And the influenza vaccine is covered by Medicare and Medi-Cal and private insurances.